I imagine, and this question's going to take a minute to unfold, but I don't know what your experience has been, but if we talk about the spectrum of religious beliefs and or you can paint it liberal to conservative,
Mhm.
um, you can talk about religions, but how do you handle the different backgrounds that people bring into this, whether it's based on their religious background, their own personal upbringing, as
Mhm.
being a conservative family or a liberal family? How do you experience these, and how do you work with them?
That's huge. That's such a big part of my style and the way I work with people is that I'm coming to them, I'm meeting them where they are. It doesn't do any good for me to sit it's kind of where I talked about how, it's one thing to say to someone, "Oh, there's nothing to be embarrassed about." Well, but they are embarrassed. So telling them there's nothing to be embarrassed about doesn't make them comfortable to talk to me.
Yeah.
And so recognizing while I may be very open and I've evolved to this, that's not where I was. I mean, growing up, I didn't talk about these things. I still don't talk about these things necessarily with my parents. I didn't grow up, not that they were conservative or made things shameful, but that's not I didn't grow up having this open dialogue in my house about these things. But I've come to this through what I do for a living and my own education. I recognize that people don't, and different religious beliefs and different, um, just social beliefs are okay, and it's not for me to say it's right or wrong. So I need to work within their comfort and their frame of reference. There are some things that I may say I'm happy to talk about and discuss, and they may say that's not something that I'm open to. That's fine. We need to work with what they're open to and make sure that we work within their comfort zone and coming to where they are. Um, I this is more kind of relationship based, but I actually, when you talk about things that you've learned or hard lessons, whatever, I don't know if this is a hard lesson, but there's a patient I reference. Um, Years ago that was a patient of mine, and I remember her talking to me about her difficulty with her husband, and they had a lot of pretty significant issues in their marriage and difficulty, and, not just sexually. And I remember her saying to me how she was in a really good place and that she worked with her therapist, acknowledging that she was Catholic and did not believe in divorce. It was not on the table. And so it wasn't a discussion of should she get divorced? Shouldn't she get divorced? Should she work through it? It was here's where I am. I need to learn and figure out how to make this work within my comfort, within my belief system. And she was able to do that. She was able to get to a point where taking that off the table, she was able to achieve her happiness and a good relationship. And I use that oftentimes when I'm talking with patients of I need to know where they are. And they may change and I can change with them. But it doesn't do me any good to offer people options and suggestions that are completely out of their comfort zone and
Mm.
completely out of their belief system. We need to work within that.
Yeah, good. Yeah, I imagine that's you talk about the fact that, in this case, she was also seeing a therapist. So maybe we'll switch over to talking about a little bit about, partnerships that you have or had with other professionals who have either referred you patients or you refer patients to them.
I
What are
actually
those?
one thing I maybe wanna expand on that one, though, is the other
Yeah,
side of the people who are more open and free and liberal.
yeah, that's
Um,
fine. That's good.
yeah.
Really.
So so I guess I would say and on the opposite side of the maybe more what we think of as conservative, upbringing or belief system, I also have on the opposite side that, even myself, I was naive to some of the types of sexual and emotional relationships and romantic relationships out there. And I've made a point to learn more and make sure people understand that they can be comfortable talking to me. I know there's all different types of relationships, whether it be gender fluidity, different genders, different sexual orientation, or whether it be non monogamous type relationships or different types of sexual activity. As long as somebody is in a consensual, safe relationship, I can work with them on what is working or what is not working for them, and there's no judgment. I don't believe that there's a right way or a wrong way to have those relationships, and if someone doesn't feel comfortable being open about what they are or are not doing with a partner or multiple partners, then I can't provide them good healthcare, and they're not getting that from their doctors if they're not being open about the types of relationships they have, and so while I can work in the realm of someone who's maybe more conservative and not open to certain things, I can also work with people who are very open and, there may be something out there that I haven't heard of yet or don't know about. That's okay. I can learn from them and work with them on it. As long as, like I said, it's consensual and safe, it's not up to me to say what's right, wrong, fun, or otherwise. So,
Mhm.
I'm very happy and open to have those conversations and work with people with all different types of experience or interest or exploring new things that they don't have experience with.
Mhm. Well, that's good. Yeah, I'd imagine that, you know, depending on the political climate,
Yeah.
that some people are not as comfortable talking with you, whether they're conservative or liberal.
Yeah.
Uh, both are influenced or yeah, are influenced by the political climate. Um, so that's to be able to bring people to an understanding of what their options are, no matter what their background is, to be able to have a conversation with them without them feeling judged is
Mhm.
huge. Yeah.
Yeah. Yeah, yeah. Yeah. I've had to Google a lot.
Yeah.
Some of these, like, groups and discussions that I'm in, there are things I'm like, "What?" And then I get so used to it that I forget. Like, I've
Yeah.
just learned some of these things, and, I just the other day was talking to someone socially, and I was saying something about somebody, that was ENM, blah, blah, they're like, "Huh?" And I'm like, "Ethical non-monogamy." They're like, "What's that?" And I'm like, "Oh, I forgot that probably 2 years ago, I would have had no idea what that meant,"
Yeah.
but that like, it's learning these things and not having a conversation, turning beet red and getting all embarrassed when someone says it. It's whatever. You do whatever you wanna do, and we'll work with it, you know?
Yeah.
I
Yeah.
don't care. So, yeah, I'm definitely try to learn all this.